Stop taking your kidneys for granted. If I told you that right now, at this very moment, one of your kidneys could be losing function while you feel completely fine, would you believe me? Most people wouldn't. And that's exactly why kidney failure is called the silent killer of the senior years. Nobody warns you, nobody prepares you. By the time you feel it, you've often already lost more than half of your kidney function. Let that sink in for a moment. I'm Dr. Rian Coldridge, who has spent decades working with patients in their 60s, 70s, and 80s. And I want to tell you something that shocked me early in my career. According to data reported by the Centers for Disease Control and Prevention, roughly 1 in 7 adults in the United States is living with chronic kidney disease. And the truly frightening part is that up to 9 out of 10 of them have no idea it's happening. 9 out of 10. That means the person sitting next to you at dinner, your neighbor, maybe even someone in your own household, could be walking around with kidneys quietly failing, and neither of you would know it. Before we go any further, I want you to do something for me. Down in the comments, tell me your age and tell me this. Have you ever had your kidney function tested in the last 2 years? Just a simple yes or no. I read every single comment on these videos, and I promise you, your answer helps me understand who I'm really talking to, and it helps other viewers your age feel less alone in this. So take 30 seconds, type it in, and then come right back, because what I'm about to share with you in a few minutes, especially the very last item on this list, is something most doctors won't even bring up during a routine checkup. It has to do with something you might be eating or drinking every single evening without realizing it's slowly straining one of the hardest working organs in your body. Now, let's talk about why kidneys fail in the first place, because understanding the why is what makes the how to protect them actually make sense. Think of your kidneys like a pair of highly sophisticated water treatment plants working around the clock, filtering about half a cup of blood every single minute of your life. Over a single day, your kidneys filter somewhere around 150 quarts of blood, pulling out waste, balancing your fluids, regulating your blood pressure, and even helping manufacture red blood cells. That's an enormous, relentless job. And like any machine that runs non-stop for 70, 80, 90 years, wear and tear adds up. After the age of 40, most people begin losing kidney function at a slow, steady rate. And by the time we reach our 70s, many of us have lost close to 30 to 40% of the filtering capacity we had in our 30s. That's a normal part of aging. But what turns normal aging into full kidney failure is almost always a combination of preventable habits colliding with that natural decline. I'm going to walk you through this as a countdown, from the 5th most damaging habit down to the single most powerful one, the one that surprises almost every patient I explain it to. Along the way, I'll tell you about the symptoms that should send you straight to a doctor, the specific tests you should be asking for, the vitamins and fruits that genuinely support kidney health, why kidney failure and anemia are so closely linked. And yes, I promise, I will tell you about the fruit that's actually excellent to eat before bed for your kidneys. Let's start at number 5. Number 5 is chronic, poorly controlled high blood pressure. I call this the silent strangler of the kidneys. Picture the tiny blood vessels inside your kidneys like delicate garden hoses, thin, flexible, designed to carry a gentle, steady flow. Now imagine cranking the water pressure up far beyond what those hoses were built for, day after day, year after year. Eventually, they crack, they stiffen, they scar. That's essentially what chronically high blood pressure does to the microscopic filtering units in your kidneys, called nephrons. Research published in major hypertension and nephrology journals has consistently shown that uncontrolled high blood pressure is one of the 2 leading causes of kidney failure worldwide, and it disproportionately affects people over 60 because our blood vessels naturally stiffen with age, making blood pressure harder to control, even when we think we're doing everything right. For aging bodies specifically, this matters because stiffened arteries, combined with reduced kidney reserve, create a dangerous feedback loop. High pressure damages the kidneys, and damaged kidneys struggle to regulate pressure, which raises it further. If you're over 60, you should be checking your blood pressure at home at least 3 to 4 times a week, not just at the doctor's office, because office readings can miss what's called masked hypertension, high blood pressure that only shows up in your daily environment. Pair home blood pressure monitoring with reducing sodium, and I don't just mean table salt. I mean hidden sodium in canned soups, deli meats and bread, which can be a genuine game changer. And here's a synergy tip many people miss. Increasing potassium-rich foods like bananas, spinach and sweet potatoes works together with lower sodium intake to help relax blood vessel walls. But only if your kidney function allows for higher potassium, which is something your doctor needs to confirm with blood work first. Now, before we move to number 4, I want to plant a seed, because number 2 on this list is going to genuinely surprise you. It's not diabetes, and it's not even a food. It's a category of medication that millions of seniors take multiple times a week, believing it's completely harmless. I'll explain exactly what it is when we get there, so keep watching. Number 4 is uncontrolled diabetes and the slow sugar damage it causes. Think of your kidneys' filtering units like incredibly fine mesh screens, so fine they can catch particles smaller than you could ever see. When blood sugar runs high for months and years at a time, it's like pouring syrup through that fine mesh over and over. The mesh gets sticky, it gets damaged, and eventually the tiny holes that should only let waste through start letting important proteins leak out, while waste products start building up in the blood instead of being filtered away. This condition, called diabetic nephropathy, is the single leading cause of kidney failure in most developed countries, responsible for close to 40% of new kidney failure cases, according to data tracked by major diabetes and kidney foundations. For seniors specifically, this is compounded by something called anabolic resistance, a condition where aging muscles and tissues become less responsive to insulin signals, meaning blood sugar tends to run higher for longer after meals, compared to when we were younger, even in people who were never officially diagnosed as diabetic. This is why an annual hemoglobin A1C test, which shows your average blood sugar over roughly 3 months, is so much more valuable for people over 60 than a single fasting glucose reading, which can look deceptively normal on any given day. If your A1C is creeping upward, pairing a lower refined carbohydrate diet with a short 10 to 15-minute walk after meals has been shown to blunt blood sugar spikes significantly, because muscle contraction pulls glucose out of the bloodstream independent of insulin. That walk after dinner might be doing more for your kidneys than you ever imagined. Let me tell you about a patient I'll call Frank, 73 years old, from a small town outside Columbus, Ohio. Frank came to see me because his ankles had started swelling every evening, and he assumed it was just getting older. His blood work told a different story. His A1C was elevated, his kidney function had quietly dropped to about 55% of normal, and he had no idea. Frank made 2 changes. He started walking after dinner instead of sitting down immediately, and he swapped his nightly bowl of sugary cereal for a small handful of berries with plain yogurt. Within 8 months, his A1C dropped meaningfully, his swelling reduced, and his kidney numbers stabilized. Frank didn't need a dramatic overhaul. He needed the right information at the right time, which is exactly why I make these videos. This brings us to a good moment to pause. If this information feels new or useful to you, hit that subscribe button right now and tap the like button, because it genuinely helps this channel reach more people your age who need to hear this before it's too late. I put a tremendous amount of research into every single video, and your support tells me to keep going. Now, let's get into number 3, because this is where things get more surprising. Number 3 is chronic dehydration, something almost every senior I treat underestimates. Here's the analogy I want you to hold on to. Think of your kidneys like a delivery truck driving on a river. When the river is full, the truck glides along smoothly, dropping off waste at the destination with ease. When the river runs low, that same truck has to drag itself through mud, working far harder to deliver the same load, and sometimes getting stuck completely. That's what happens inside your kidneys when you're chronically dehydrated. Blood becomes thicker and more concentrated, and your kidneys have to work significantly harder to filter out the same waste products, especially urea and creatinine, 2 substances your doctor checks in every kidney blood test. What makes this especially dangerous for people over 60 is that our natural thirst signal weakens with age, sometimes by as much as 40% compared to when we were young adults, according to research on aging and thirst perception. This means many seniors are mildly dehydrated for days or weeks at a time, without ever feeling thirsty enough to notice. The practical fix isn't complicated, but the timing matters. Rather than drinking large amounts all at once, which can overwhelm an aging bladder and disrupt sleep, spreading fluid intake evenly across the day, roughly 6 to 8 glasses, depending on your doctor's guidance for your specific heart and kidney condition, keeps that river flowing steadily. A wonderful synergy tip here is adding a slice of cucumber or a few berries to your water, not just for flavor, but because these foods carry natural water content and gentle antioxidants that support the same filtering process. Now let's talk symptoms, because I promised you I would tell you exactly what to watch for. Early kidney failure is sneaky, specifically because the symptoms mimic ordinary aging complaints. Persistent fatigue that doesn't improve with rest, swelling in the ankles, feet, or around the eyes, especially in the morning, foamy or bubbly urine, urinating far more or far less than usual, particularly needing to go frequently at night, a metallic taste in the mouth or loss of appetite, muscle cramps, especially at night, itchy skin that lotion doesn't seem to fix, and unexplained shortness of breath. Individually, any one of these could mean something minor, but if you notice 2 or more of these together, especially if they've developed gradually over several months, that is your signal to ask your doctor directly for kidney function testing. And here is exactly what to ask for. First, a basic metabolic panel, which includes your creatinine and blood urea nitrogen, often shortened to BUN. Second, and this is the one most people forget to ask for, your estimated glomerular filtration rate, called eGFR, which converts your creatinine level into a percentage estimate of how well your kidneys are actually working. An eGFR above 90 is considered normal, but many seniors are walking around in the 60 to 80 range without knowing it, which is considered mild kidney function decline. Third, a urine test called a urine albumin to creatinine ratio, which detects protein leaking into your urine, often one of the earliest detectable signs of kidney damage, sometimes appearing years before creatinine itself rises. If you have any family history of kidney disease, diabetes, or high blood pressure, I recommend asking for all 3 of these tests annually, not just when something feels wrong. Now let's talk about something that surprises almost every patient: the connection between kidney failure and anemia. Here's the piece most people never learn until they're already deep into kidney disease. Your kidneys don't just filter waste, they also produce a hormone called erythropoietin, which signals your bone marrow to produce red blood cells. Think of erythropoietin like a factory foreman shouting instructions to the workers on the floor, telling them exactly how many red blood cells to produce each day. When kidneys begin failing, that foreman's voice gets quieter and quieter, fewer instructions get sent, and your bone marrow slows down red blood cell production, even though your body still desperately needs oxygen carried throughout your tissues. This is why anemia, which shows up as persistent fatigue, pale skin, dizziness, cold hands and feet, and shortness of breath during simple activities like climbing stairs, is often one of the very first noticeable symptoms of declining kidney function, sometimes appearing before a person even realizes their kidneys are involved at all. If you've been told you're just anemic and given iron pills without anyone checking your kidney function, I would gently encourage you to ask your doctor whether your kidneys have been evaluated as part of that picture, because treating the anemia without addressing the underlying kidney decline is treating the smoke without looking for the fire. Now let's move to number 2, the one I teased earlier. The medication category that shocks almost everyone I explain it to. Number 2 is the regular long-term use of over-the-counter pain relievers called NSAIDs, which stands for non-steroidal anti-inflammatory drugs. This includes common names you almost certainly recognize, ibuprofen and naproxen being the 2 most widely used. I want to be very clear, these medications are not dangerous when used occasionally and appropriately. The danger comes from the pattern I see constantly in patients over 60, taking these pills multiple times a week, sometimes daily, for chronic arthritis pain, back pain, or headaches for months or years at a time, often without any doctor actively monitoring kidney function during that period. Here's the mechanism, and I'll keep this simple. Your kidneys rely on specific blood vessels that dilate or widen to maintain proper blood flow and filtering pressure, especially when the body is under any kind of stress. NSAIDs work by blocking certain inflammatory compounds called prostaglandins, and unfortunately, those same compounds play a critical role in keeping those kidney blood vessels properly dilated. Block them chronically, and those vessels constrict, blood flow to the filtering units drops, and over time this can cause a slow, cumulative form of kidney damage that research has linked to a meaningfully increased risk of chronic kidney disease with long-term regular use, an effect that becomes significantly more pronounced in people over 60 because aging kidneys already have less reserve capacity to compensate for reduced blood flow. This is compounded by something we call inflammation load in aging bodies, where chronic low-grade inflammation from arthritis or other conditions already puts extra stress on kidney tissue. And adding a medication that further disrupts blood flow regulation on top of that existing inflammation creates a much bigger cumulative burden than it would in a younger person's body. My practical guidance is not to panic if you've used these occasionally, but if you find yourself reaching for ibuprofen or naproxen more than 2 or 3 times a week for chronic pain, that is a conversation to have with your doctor, because there are often alternative pain management strategies, including topical treatments, physical therapy approaches, and other medication classes that don't carry the same kidney burden. A helpful synergy tip if you do need occasional NSAID use is to always take it with food and adequate water, never on an empty stomach or while dehydrated, because that combination significantly increases the strain on kidney blood flow in that moment. I want to introduce you to another patient before we reach number 1, a woman I'll call Linda, 68 years old, from a suburb outside Sacramento, California. Linda had lived with knee arthritis for over a decade and had been taking ibuprofen almost every single day, sometimes twice a day for years, simply to stay mobile and active with her grandchildren. When her routine blood work showed her eGFR had dropped into the 50s, she was frightened and confused. She'd never been told this was even a risk. Working with her doctor, she transitioned to a topical anti-inflammatory gel for her knee, added gentle water aerobics twice a week to manage pain through movement instead of medication, and within a year, her kidney function had actually improved back into a safer range. Linda's story is a reminder that this damage, when caught early enough, is not always a one-way street. Now, before I reveal number 1, I do want to remind you that every study and statistic I'm referencing in this video is listed in the description below, so you can read the original sources yourself and share them with your doctor or your family. Number 1, the most powerful and most surprising factor on this entire list is chronically excessive sodium and phosphorus intake hidden inside processed and packaged foods, combined with something almost nobody thinks about, phosphate food additives specifically. Here's why this ranks above everything else we've discussed. Sodium we've touched on already through blood pressure, but phosphorus is the hidden villain that almost no one talks about. Healthy kidneys are remarkably good at regulating phosphorus, keeping it in careful balance in your blood. But processed foods, deli meats, packaged baked goods, dark colas, and many frozen convenience meals are often injected with inorganic phosphate additives, a form of phosphorus that your body absorbs at a rate of up to 90%, compared to only 40 to 60% absorption from natural phosphorus found in whole foods like meat, dairy, or beans. Think of your kidneys like a warehouse manager trying to keep inventory perfectly balanced. Natural phosphorus arrives on a slow, predictable delivery schedule the manager can plan around. Additive phosphorus arrives in a chaotic flood, all at once, overwhelming the manager's ability to keep the shelves balanced. Over years, this repeated flooding contributes to vascular calcification, a hardening of blood vessels, including those inside the kidneys themselves. And research in nephrology journals has associated chronically elevated phosphate levels with faster progression of kidney function decline, particularly in adults over 60, whose kidneys already have reduced reserve capacity to manage these swings. This matters enormously for aging bodies because, combined with age-related sarcopenia, the natural loss of muscle mass that also affects how the body processes and stores minerals, the compounding effect on kidney workload becomes significantly greater than it would be in a younger person eating the exact same processed diet. The practical fix here isn't about eliminating all animal protein or living a restrictive life. It's about becoming a label reader. If you see any ingredient with the word phosphate in it, on your deli meat, your bacon, your flavored bottled water, or your favorite dark soda, that is additive phosphorus, and it should be minimized specifically, not just phosphorus in general. Natural sources of phosphorus in moderate amounts found in fish, eggs, and beans are handled far more gently by your kidneys and don't need to be feared the same way. And now, as promised, let's talk about the best fruits to eat before bed for genuinely healthy kidneys, because this ties everything together beautifully. Blueberries stand out here in a remarkable way. They are naturally low in potassium and phosphorus compared to many other fruits, which matters greatly for anyone with declining kidney function who needs to be mindful of mineral load, while being exceptionally rich in antioxidants called anthocyanins, the same compounds that give them their deep color. These antioxidants have been shown in research to help reduce oxidative stress, which is essentially cellular wear and tear caused by unstable molecules. And reducing this stress specifically benefits the mitochondria, the tiny energy-producing structures inside your kidney cells, which naturally become less efficient with age. A small handful of blueberries in the evening, roughly half a cup, paired with a few unsalted walnuts for their gentle anti-inflammatory fats, creates a wonderful synergy. The fat in the walnuts slightly slows sugar absorption from the fruit, keeping blood sugar steadier overnight, which, as we discussed earlier, directly reduces strain on those delicate filtering nephrons while you sleep. Apples with the skin on are another excellent nighttime choice. They're relatively low in potassium, high in a specific soluble fiber called pectin, which research suggests may help bind and reduce certain waste products in the digestive tract before they ever reach the kidneys for filtering. And cranberries, whether fresh or as an unsweetened juice in small amounts, have long been studied for their role in reducing urinary tract infections, which matters because untreated infections can travel upward and place additional acute stress on kidney tissue, something that becomes more common and more dangerous the older we get. As for vitamins, I want to mention a few worth discussing with your doctor, specifically in the context of kidney protection. Vitamin B6, B12, and folate all play a role in managing homocysteine, a compound that in elevated levels has been associated with vascular stress that can affect kidney blood vessels alongside heart vessels. Vitamin D, which a significant percentage of seniors are found to be deficient in, according to widespread population studies, plays an important role in regulating calcium and phosphorus balance, working in partnership with your kidneys rather than against them, though supplementation should always be guided by a blood test first, never guessed at, because both too little and too much can create problems. And I want to gently caution you here. High-dose vitamin C supplements, when taken well beyond the recommended daily amount, have in rare cases been associated with kidney stone formation in people with existing kidney vulnerability. So more is not always better, and food sources of vitamin C, like the fruits we just discussed, are almost always the safer route. Now, let's bring this all together because I know this has been a lot of information and I want to make sure it lands with the weight it deserves. Your kidneys are not just filters, they are the quiet guardians of your independence. They are what allow you to wake up clear-headed instead of foggy, to walk without swollen, aching legs, to travel, to hold your grandchildren, to live in your own home instead of depending on others for basic care. Kidney failure doesn't happen overnight, and that is genuinely the good news buried inside all of this. It happens slowly, quietly, over years, which means you have time, real time, to change its trajectory. Frank changed his trajectory with a walk after dinner. Linda changed hers by rethinking a pill she'd taken without question for a decade. Neither of them did anything extreme. They simply learned what their kidneys needed, and they listened. It is genuinely never too late to start protecting this organ, whether you are 62 or 92, whether your last blood work looked perfect or worried you. The choices you make this week, this month, can meaningfully change the years you have ahead, and more importantly, the quality of those years, the independence of those years. If this video gave you something valuable today, something you didn't know walking in, please subscribe to this channel, because I make these videos specifically for people who refuse to let aging happen to them passively, people who want to understand their own bodies well enough to advocate for themselves in every doctor's appointment from here forward. And before you go, I want to ask you directly, down in the comments, tell me which one of these 5 surprised you the most. Was it the pain reliever connection, the hidden phosphates, or something else entirely? I read every single comment, and your answer might just become the subject of my next video.